Using the Staebel patient transfer device is very, very simple. My colleague Quentin here, I'm going to transfer him from this seat using the Staebel patient transfer device, and I'll transfer him back to the seat he's sitting in, but we just want to show you how you use the device. Before we approach the seat or our resident or patient, we want to fold the paddles back, okay? This giving us the best access in preparation for the transfer. So, of course, you're going to be communicating with your resident. So, Quentin, we're going to use this device to bring you to a standing position, and you're going to seat back onto the seat paddles. Be restful, and we'll transfer you around the room for a little ride, and then back to your chair again.
Will I be safe and secure, Scott?
You will be, Quentin. You can be confident using this. So, I'm going to ask you to hold onto the bars, and after the count of 3, we're going to lift to our feet. I want you to stand, and when you're standing, I'm going to just close these paddles behind you, one at a time. So what you'll see is that there's nowhere for you to go outside the confines of this product. Also, we have a nice, soft, padded knee rest here as well, so you're not going to be coming in contact with any hard protrusion points or anything like that. Although it's robust, it is comfortable.
Okay.
Does that sound all right for you, Quentin?
Yeah, it does. I'm ready for a transfer.
Very good. I'm going to adjust the base of the Staebel patient transfer device to suit the seat that you're sitting on. So the seat you're sitting on is fairly standard, fairly average size. If you were sitting in a seat a lot wider, Quentin, I could still use this device around the seat that you're sitting in. So it could be a big broad day chair. You could have room next to you for a few cushions and a few books and perhaps a packet of biscuits.
That's very good, because there's some very big chairs out there. I'm concerned it might not have been able to get around, but I'm glad to hear it can get around a lot of chairs, big ones.
Very good. I haven't come across too many chairs with this product that doesn't work with.
Very good.
I have come across products where we've had challenges, we've had restrictions, space restrictions, but this one answers everything we need to do, and hopefully it will do for you. So I'm going to move this up to your chair now, Quentin. I'm going to ask you just to raise your feet. Thank you very much. Oh, brilliant. I've got nice and close. Okay, I'm just going to put the brakes on. Okay, so I've got the base around the chair. Quentin's in a good position to make contact with this bar here. Okay. And lift up to 3. Brilliant. Excellent. I'm just going to close this paddle behind Quentin. And take a seat. Very good. Now I'm just going to release the brakes, and I can move Quentin around the room with very, very minimal effort. Okay. Quentin, you asked me if you felt you're going to feel safe and you're going to be secure in this product. How do you feel?
I actually feel more than safe and secure, Scott. I feel very comfortable.
Very good.
Nicely supporting the sitting position, and it's very, very comfortable on my knees.
Excellent. Now, if you wobble from side to side, you'll also prove that it lives up to its name, the Staebel patient transfer device. Very, very stable, very, very firm, and very, very robust in its field, not just for the assistant and carer, but also for the person using the device.
This area I'm holding onto, Scott, is it easy to clean, since lots of people will be using it?
Very much so. So quite typically you would normally clean your equipment probably with some form of wipe, and that withstands that and is well used to being cleaned with perhaps a clinical wipe or even just warm soapy water, but cleaning the product is key.
Very good.
So Quentin, I'm going to transfer you back to your chair. Is that okay?
Yes, please.
Good, so I'm just going to move you backwards now. Okay. Your chair is just behind you. Okay. I'm going to put the brakes on. Now I'm going to ask you to stand. Thank you. Just moving the paddles away from behind you, and you can be seated again. But as you'll see, very importantly, we've managed to maneuver Quentin back into the seat, into the perfect seating position without having to shuffle back into the chair. So right now I can take the device away from Quentin, so if you wouldn't mind just moving your feet for me, I'm going to release the brakes. And that's the transfer done. Quentin is comfortable, he's safe. We've transferred him with no risk of shearing, and he felt comfortable and stable on the device as well.